Hello everyone, this is Dr. Tanya. I'm a high-risk pregnancy consultant. So today I'll be talking about the importance of anti-nuclear antibodies and what is to be done next if they come out to be positive. So what are anti-nuclear antibodies? They are a group of antibodies that bind to the cellular components of a nucleus like protein, RNA, DNA, etc. Anti-nuclear antibodies, they can be found positive in 20 to 30% of healthy population, especially females and elderly people. These ANAs, they are their production is strongly age related, it's age dependent, and as the age advances, they can be found in the blood, especially when the individual is more than 65 years of age. So anti-nuclear antibodies, the mere presence of these antibodies in the blood does not mean that the patient is having connective tissue disorder. It is the titers of anti-nuclear antibodies which tell us that yes, this might be a case of connective tissue disorder, that I'll be talking about a little later. So once anti-nuclear antibodies are present in the blood, the test need not be repeated again. But if the test comes out to be negative and you have a strong clinical suspicion that this might be a case of connective tissue disorder, so in that case you can repeat the test again. Anti-nuclear antibodies, they can be positive in many situations. One is they can be positive in systemic autoimmune diseases. They can be positive in organ-specific autoimmune diseases, for example, diseases of thyroid, lung, liver, etc. And they can be found in certain infections like infectious mononucleosis, hepatitis C, HIV, TB, subacute bacterial endometritis, etc. So once anti-nuclear antibodies, they are positive in the blood, next is we have to screen the test. Like they have come positive, the next test will be IIF, that is indirect immunofluorescence test. This indirect immunofluorescence test is a gold standard screening test, and it is done on Hep2 cells. What does this test tell us? Now when we do this test, we observe two things. One is the titer of anti-nuclear antibodies, and second thing is the staining pattern, that is a nuclear staining pattern. So first I'll talk about the titers. Titers 1 is to 160 or above that, that is the standard cutoff which is taken by most of the labs, and that is considered to be positive. If it is 1 is to 160 or above that. And as far as the staining pattern is concerned, this is the reading of the staining pattern is a very valuable tool in ANS testing. Now staining pattern, you can find different stains, like it can be homogeneous, it can be peripheral, it can be speckled appearance, it can be centromeric. So there can be so many patterns which can be found, and they are specific for a disease. For example, connective tissue disorders, there are so many, like it can be SLE, it can be Sjogren's syndrome, it can be scleroderma, it can be myositis, and the list goes on. So the pattern tells us that that this might be this particular disorder. For example, let's talk about the speckled appearance. So speckled appearance somewhere tells us that this might be Sjogren's syndrome. Homogeneous and peripheral pattern, it is mostly found in SLE. So pattern, just because it's a screening test, it's not a confirmatory test, so it will tell us that that this might be this disorder. And if you see the clinical symptoms are also the same, so you can order the antibodies, the specific antibodies for that particular disorder. You need not order the entire test where all the antibodies are to be seen. These are the two things which are found on IIF, and but the limitations of IIF is there. Like this test is, the interpretation of this test is little difficult. You need expertise for this. So not everyone can read all the stains. So the reading of the pattern is very important. These are the 2-3 drawbacks which are there for IIF. But still, it's a gold standard screening test. Now, once this comes out to be positive, so we have to move on to the confirmatory test.